One of my favorite forms of estrogen that my patients use is an estrogen cream because it's so cheap, so it goes a long way. But one thing that I found is a lot of doctors don't have the time to go over education of how to properly insert and use the estrogen cream. So I'm going to go over that right now because that's something I go over in detail with my patients. Number one, when you use an estrogen cream, you should only be using about 0.5 grams each time. On the box, it might say to use 1 to 2 grams. Do not follow that. In a whole week's time, you really should only be using about 1 gram total. So if you're applying it twice a week, each time only about 0.5 grams should go in that applicator. Number two, you should be buying throwaway applicators. So go online and buy throwaway applicators. If you are conscientious about the planet and you don't want to be buying plastic pieces that are going to be thrown away often, then maybe vaginal estrogen cream is not best for you. Maybe you want to use a ring or something that's more environmentally friendly. Anyways, once you have your applicators and you have 0.5 gram in there, you are going to insert it deeply into the vaginal canal, very far up into the vaginal canal, and squirt about half of that cream into the vaginal canal as far up as you can, because we have a lot of receptors up there, and especially for those of you who have bladder symptoms and so forth, if you're not getting it deep back in there, you're not going to address those tissues and those symptoms. And then I want you to keep some of the cream, and I want you to take it and put it on your finger, and I want you to actually apply it externally on the clitoral tissue here, and then on the outside of this vulvar tissue. So this is your labia minora. I want you to put it on the labia minora, on the urethra, this external urethra, along the vestibular tissues, on this little area down here, which is called your posterior foramen. And I even want you to put a little bit on the perineal body and on the rectum. But you're going to start here and go all the way down with that cream. You just need a little bit, goes a long way. Coat all of that tissue. So put it deep into the vaginal canal, take a little bit of it and start and rub it all the way down. Again, around twice a week is often how your GYN will prescribe that. Always follow the recommendations from your prescribing doctor.